Okay,
Great.
so we're going to answer some questions from Instagram, and we had some always good questions from our audience. Can you get nice improvements on the neck, anti-aging, starting with just creams alone? And it's a very complicated area, but there's a long answer and a short answer.
Right. Why don't we just jump into the short answer?
Yes.
So short answer, what's the verdict? Will creams really help tighten the neck?
It's a good start, and you have to start early, and you have to be consistent with your creams. The number one cream to use, of course, is sunscreen. So the neck laxity is all about sun exposure, and that sun exposure, day by day, minute by minute, week and month and year and decade, they really add up, and the neck is all about the sun.
This was really supposed to be the short answer.
Oh, yeah.
Okay, so the short answer, do creams actually help with neck tightening? I would say probably not. They're not really going to tighten things and really give you a visible difference. So that's the short answer. But let's dive into the long answer. I think the long answer, first you have to think about why is it that the neck changes over time. And if you look at the anatomy of the neck, it's actually quite complicated. There's multiple layers. So starting with the skin on the very surface, there's the subcutaneous fat underneath. Behind that, there's a layer of muscle. Behind that, a deeper layer of muscle. And as we age, all of these structures start changing. So one at a time. So looking at the surface of the skin, so the skin itself can best be protected by using sunscreen.
And clothing. And clothing.
Protective clothing, especially if you're out there in intensive sun.
There are new gaiters that are being designed for people to pull them up and down, and then they're loose and they're tight, and they're really quite creative, I find.
Right. Or what I tell my patients, especially the golfers and the tennis players that are out for hours at a time, wear your t-shirt, like your collared shirt with the collar flipped up, right? We can sport the preppy look, and you get a little bit of extra protection from the sun. So other creams that might help that surface of the skin. So sunscreen, obviously, to prevent that problem from happening. Then we have things that will help stimulate collagen. So that's about your retinoids. There's anti-inflammatory creams such as vitamin C that are antioxidants that you can apply on a daily basis. Also is going to help prevent that damage from happening over time. There's hydrating creams like hyaluronic acid-based creams or other emollients that are mixes of water and oil that's going to help hydrate the skin and keep it plump over time. Then there's a whole new category of creams.
Oligopeptides and growth factor serums and biohacking of the elements in the skin that are helping to plump the collagen and help the skin.
Yeah, and those peptides are all about intracellular signaling. So it sort of helps wake up those fibroblasts that are sitting deep in our dermis to help stimulate new collagen. And then there's hormonally derived creams. So that's a hot new topic right now. So for women that are peri and postmenopause, it would be applying estrogen style creams helpful for the quality of the skin.
The jury's out on that. Not a lot of evidence in that space, but maybe
not yet.
Maybe
not yet.
We'll get there.
Yeah, not yet, but it's certainly coming. Then other things that causes sagging or looseness in the neck is the deeper layer, which is the fat layer. So for some people, they might notice a sagging because they might have some excessive fat underneath their jawline or their mandible, which makes their neck look a little bit heavy or saggy. So in that instance, creams obviously are not going to help, but there are certain injectables such as Belkyra, which is deoxycholic acid. We can inject that. It's a very simple 10-minute procedure, and that helps to dissolve the fat under the skin. There's also surgical procedures such as liposuction that can help.
But I mean, the topic of conversation more recently, as of a couple of weeks ago, was did Demi Moore get a facelift or Kris Kardashian? And of course they did. They got maybe a full face, maybe they got a 2/3 or a mini neck lift with a tightening, but it always involves the neck skin. You can't do a facelift really without pulling the neck up, and it tucks everything in behind the ear and notches everything up, and it's nothing really non-surgical replaces surgery. It's two different realms really.
Well, and I would say it depends also on what the fundamental issue is, right? So for example, if there's a lot of looseness in the underlying muscle, so that's the platysma bands, you really need to do surgery to tighten up those deeper structures. But if it's the skin itself, sometimes sometimes non-surgical interventions can be helpful?
Well, in our clinic, we do a lot of biostimulatory hyperdilute fillers in the neck, and they are producing fabulous results. So it's skin-directed skin health, skin structure, and the better your skin, even if you decide 5, 10, 20 years after, you're prepping your skin, you're going to get better results with your surgery.
Exactly.
So it really is sort of these stepwise approaches and these things that you can do along the way while you're making the ultimate decision of knife or no knife. And
oh yeah, absolutely.
Yeah.
Like, the collagen stimulators. So these are products like Radius and Sculptra that we've been using for quite a while, can help thicken the dermis, right? So that's the surface. So the epidermis, the dermis, it can help thicken and plumpen it and give it a little bit more structure.
there's lots you can do to get started. And starting with a good skincare routine is everything that we recommend in the clinic, starting with sunscreen, peptides and vitamin C, and light retinol, because the neck can be a little sensitive and delicate.
Definitely, you can get started with the creams, but it also depends on where you're at. So you're certainly not going to get the same results with the cream as you would get by other interventions. Thanks, everybody, for your questions. We're going to get back with some more answers to other questions as we go. Keep submitting them. We'd love to hear from you. Thanks.
Bye-bye.